Good afternoon, and thank you for joining us for today's briefing. It's my pleasure to introduce to you the Commonwealth's Director of Testing and Contact Tracing, Michael Huff.
Good afternoon and Happy New Year. Thank you for joining us today. Today is my first briefing for the 2021, and I'm encouraged about Pennsylvania's continued response regarding COVID-19 testing. However, case investigations and contact tracing remain a challenge. Lindsey Mauldin, Special Assistant on Contact Tracing for the Department of Health, is with me today and will discuss some of those changes and challenges in a moment. With vaccination administration for COVID-19 beginning, we are moving in the right direction to safely get all of us closer to our normal way of life in the new year. I'd first like to give an update on COVID-19 testing in Pennsylvania. To date, over 8.3 million test results have been received in Pennsylvania. Our COVID-19 testing provider, AMI, continues to offer regional testing in 5 counties each week. Last week, the regional testing sites were in Beaver, Clearfield, Juniata, Potter, and Schuylkill counties, and tested approximately 4,000 individuals. This week, the regional testing sites are in Crawford, Dauphin, Lehigh, Somerset, and Union counties, and will conclude on Friday. As always, I would like to say a special thank you and recognize all the individuals and participants who assist with our regional testing sites to make them so successful. The locations for next week's regional testing will be announced later this week. And as a reminder for those sites, testing will be available daily from 9 a.m. to 6 p.m. No appointment is necessary. Testing is on a first-come, first-served basis and is completely free to all patients. Patients are not required to show symptoms of COVID-19 in order to be tested. Patients are encouraged to bring a photo ID or insurance card for identification. Registration is completed on-site, and patients must be ages 3 and older. Up to 450 patients can be tested per day, so get there early. And the test will be a mid-nasal passage swab PCR test, the gold standard test. The turnaround time testing will be 2 to 7 days after that. Individuals who are tested should self-quarantine while they await the test results. And individuals who live with other people should self-quarantine in a private room and use a private bathroom if possible. Others living at home with the individual awaiting the test results should stay at home. The Department of Health has additional instructions for individuals waiting for a COVID-19 test result on their website at health.pa.gov. Individuals who test positive will receive a phone call from AMI, while individuals who test negative will receive a secured PDF email with those results. Our testing planning continues as Pennsylvania identified as Phase 1A are receiving their first dose of recently approved COVID-19 vaccines, providing all of us much-needed optimism. However, widespread access to the vaccine will take several months, and many communities across Pennsylvania continue to report record high levels of new infections and hospitalizations. This current reality must serve as a reminder to remain vigilant to ensure the safety and well-being of our families, friends, and communities. Our approach to COVID-19 testing for the late winter, spring reflects the current reality and our commitment to keep our communities safe. Our goal is to provide easy access to testing for the community, especially those populations who are vulnerable or at higher risk to increase safety and decreased exposures from those who may be symptomatic, as well as those who may be asymptomatic In other words, those not experiencing any COVID-19 symptoms. This is what is referred to as surveillance testing, and it's estimated that as much as 25 to 40% of COVID-19 infections are asymptomatic, patients with no signs or symptoms of disease. With general population surveillance testing, the goal is to identify and mitigate asymptomatic cases in the community. Even though the hope is that there will be a COVID-19 vaccine available for most people sometime this new year, the vaccine does not override the importance of continuing to test for the virus and contain it to stop the spread. The virus remains a very real threat and one we must take seriously by following mitigation orders and continuing to test. Even those individuals with a positive sample and no symptoms will require at least 10 days of isolation from the day the sample was taken. Ultimately, all protective mitigation measures, testing and vaccinations work in conjunction to provide a safe and healthy Pennsylvania. Throughout this pandemic, we have benefited greatly from tremendous testing partnerships that allowed us to administer more than 8 million COVID-19 tests across Pennsylvania between April and this past December. Given infection rates in Pennsylvania and elsewhere, our public health team will focus on increased surveillance to ensure we can quickly and effectively identify and isolate instances of infection in our communities. So I'm asking you to please remember, wear your mask, wash your hands, social distance, avoid those large groups, download the COVID-19 Alert app, and please answer the call and participate in case investigations and contact tracing. Next, you'll be hearing from Lindsey Mauldin, Senior Advisor with the Department of Health, who will talk about the contact tracing program. Lindsey?
Thank you very much, Director Huff, and again, Happy New Year to everyone. As we move into the new year, I want to take a moment to reflect on some of the outcomes from 2020. Although both contact tracing and case investigations are proven health practices that have been around for decades, the COVID-19 pandemic has tasked us to truly expand both programs to mitigate the spread of this dangerous virus that can be transmitted so easily. In 2020, we hired more than 1,000 contact tracers, promoted some of these tracers to become case investigators, and built workflows and best practices to sustain these efforts moving forward. These case investigators and contact tracers continue to work tirelessly to make calls and often have challenging conversations each and every day to ensure Pennsylvania's residents stay safe. As NPR recently reported, we've learned by having these hard conversations that our infrastructure needed to incorporate social support coordinators to support the needs of individuals facing hardships with quarantine. Things like supports for food insecurity or housing, or maybe even supports for those facing mental or substance use disorders. We are fortunate to have 10 social support coordinators in the Commonwealth today. Expanding our contact tracing program and building a public health infrastructure to support the needs of COVID-19 cases could not have been done without the federal funding support from the Centers of Disease Control and Prevention. Through this federal funding, we've worked to build our public health infrastructure. We've had the opportunity to modernize our systems through the implementation of the mobile app and the contact tracing management system. We've provided public health training and experience to individuals who may have not had a job due to layoffs caused by COVID-19. We've also had the chance to work with organizations and individuals who simply want to make a difference in their community and in Pennsylvania. As we press forward into the new year, we continue to assess our needs to best support case investigations and contact tracing efforts while also ensuring that staff have sufficient training and workloads along the way. As Pennsylvania continues to report increases in cases, we recently promoted some of our contact tracers into case investigator roles. We've also made adjustments to contact tracing hours to further support the longevity of the program. This will ensure we have funding available for a longer period of time to effectively monitor the close contacts that we identify through case investigations. It is our hope that as we roll into this new year, there will be additional funding and resources available to support these ongoing efforts to keep Pennsylvanians safe and healthy. In the meantime, we recently launched the Connect and Protect form that enables contact tracers to call COVID-19 cases to gather their email, share the 6-digit code for the COVID Alert app, and send a form to complete a digital case investigation. We're excited to continue to use this and other tools to connect more public health professionals with more residents in an efficient manner. This timely connection will help us to learn where people went and who they were in close contact with while infectious, and will further help to protect loved ones and our neighbors across the Commonwealth. I'd like to share one last note. As Director Huff mentioned, we continue to ask Pennsylvanians to answer the call, even as we begin a new year in this pandemic. All of the work done by our public health professionals cannot be done if Pennsylvanians do not answer the call. So again, I stand here to urge Pennsylvanians to answer the call. Answer the call if a public health professional is calling you. Answer the call if a contact tracer is calling you. Answer the call to protect your community by completing the case investigation. Answer the call to do your part to protect your community. Thank you. And now, Director Huff and I would be happy to take any questions.
Thank you, Lindsay. Our first question is from Boris at the Scranton Times-Tribune. Boris, you should be able to unmute. Are you able to unmute, Boris?
Sorry, I'm
Now you're good.
Can you hear me?
Yes.
Hi. I've had a number of calls over the last few weeks from people claiming that the virus load from a common cold can result in positive COVID-19 tests. I've never really researched this. I'm just wondering if there's any truth to that. I think some of these people are of a conspiratorial nature, so I have some doubts, but I just wanted to know if you could address that.
It's something that we'll certainly follow up with our epidemiology team, but I would tell you that it's highly unlikely that would occur, and if it would be a frequent occurrence, it would be something that we would all be very much aware of. But I will commit to having a follow-up, and we'll make certain that you get that information.
Also, if I may, I'm just wondering to what extent you can continue contact tracing considering the caseloads that you're seeing now.
Yeah, that's a great question. So we have prioritized case investigations, and that is another reason why we've implemented the Connect and Protect form. The Connect and Protect form helps to take some of the load off of the case investigation calls that our public health officials make and allow for folks to more efficiently complete the case investigation. So contact tracing is absolutely a public health tool that we will continue using. We're just looking at various ways that we can make it more efficient and a little bit easier to use for the public.
Thanks.
Thanks, Boris. Next up, we have Asha Prihar from PLS Reporter. Go ahead and unmute.
Hi, thank you. Yeah, so I just wanted to follow up on that last thing. As far as the Connect and Protect form goes, how's that been going, and what sort of have you seen an increase in the number of close contacts that you've been able to reach out to because of this form being available? I guess what impact has it had?
Yeah, that's a great question, and I'm happy to answer it. So since the launch of the Connect and Protect form, tracers have made over 31 calls to reach 49% or 975 individuals successfully. Of the 827 that were sent forms last week, 40% or 332 forms were completed and collected. So we're able to add these case investigation numbers. The folks who are filling out the case investigation form, we're able to add that to our total of case investigations completed. And of course, as we have that data come in, we're also able to collect the contacts that come in from that form as well. And one other thing I would add, Asha, sorry, Sarah, we are also continuing to add staff so that we can continue to get through those numbers. We are seeing that we could add additional staff to be able to make those calls.
Great, thank you.
Great, thanks. Next up, we have Jamie Martinez from Spotlight, PA. Go ahead, Jamie.
Hi, Lindsay. This question's for you. Thanks for taking questions today.
Sure.
This kind of piggybacks on Asha's question, but I'm looking at the cases successfully contacted over the past couple weeks, and the number really hasn't changed that much, kind of hovering between 6,000 and 8,000. I'm wondering if you can talk a little bit more about what the department's doing to get those numbers up and how you expect that to change maybe if we hopefully see cases decline over the next few weeks now that we're out of the holidays.
Yeah, absolutely. So again, the Connect and Protect form is another layer for us to be able to collect information from folks. We're also increasing the staff on the calls to that Connect and Protect form. And we've also added additional case investigators to be able to support the public health professionals making those calls. We're continuing to assess the data that we see in our contact tracing management system. And to your question from a few weeks ago, Jamie, are looking at the capacity of our tracers and setting goals for them so that we can keep an eye on those calls, what their capacity might look like, and what our needs might be moving forward.
And thank you for circling back to my question from a couple of weeks ago. I appreciate that. When those metrics are settled, are you going to be able to share those with us?
We hope to be able to share as much as we can to be able to share what we're doing and the success of the program. Absolutely.
Okay, thank you.
Thanks, Jamie. Next up, we have Daveen from the Beaver County Times. Go ahead, Daveen.
Actually, I don't have anything for today. Thank you.
That's quite all right. Next up, we have Liz Kilmer from WPXI. Liz, I just need to unmute you here real quick. Go ahead.
Hey there, two questions. Are we still seeing a lot of resistance with folks answering the call literally and figuratively? And of the individuals who are answering the call, what are the top, things that we're still seeing them do? Are they all going to restaurants? Are they all, getting together with families? Were they all, joining for the holidays? What can you share along those lines?
Sure. So I can say that with the data that we're seeing from the Connect and Protect form, those calls that we're making, folks are picking those up. We are able to reach, again, just under 50% of those folks, and then those folks are agreeing to fill out the form and send that data back in. I think more large scale, we are, again, when we talk with folks, they are agreeing to quarantine. We've seen the numbers of folks refusing to quarantine go down, especially over the last few weeks. So again, we'll continue to take a look at that. And I really can't say, when we talk with folks, I don't know, and I'm happy to circle back with you on data on those specifics about where folks are going and what we're seeing. But again, I think that really the conversation is about ensuring that folks know what they need to be doing over the next 10 to 14 days and how they can keep themselves and their families safe.
Thank you. Next up, we have Barbara Barr from WGAL. Go ahead, Barbara.
Thank you. For Michael, I was wondering, with the case of the variant being found in New York State, has there been any case here in Pennsylvania? We certainly haven't heard of that. And what is the state doing? How are you working with the CDC as far as sending samples there to test for the variant in the UK? And now we're also hearing about one from South Africa, and your level of concern.
Well, Barbara, we're not aware of any of those cases in Pennsylvania at this particular point in time. We are sending samples to CDC. We work very closely with CDC in terms of helping to identify if any of those variants are there. In terms of preparation, the one thing that the Department of Health is doing is working very, very hard to be able to actually do that genetic analysis in our own lab. And that's something that you will see in the very near future. So in addition to sending it to CDC, we'd be able to do that analysis here in Pennsylvania as well. Please keep in mind, as I know you've heard before, that the viruses continue to change. This is not unusual. That every virus that there is continues to change. That's why for general flu, each year we have a different concoction of flu vaccine. But we are being vigilant, and obviously the goal right now is for us to continue to be vigilant, continue to test, and to rapidly get our immunizations, our vaccinations out there as fast as we can. As fast as we get them out. Thank you for that question, Barbara.
You're welcome. Thank you.
Thanks, Barbara. Next up, we have Harry Lee from Fox 43. Go ahead.
Good afternoon. My question is, you mentioned earlier that the vaccine does not override contact tracing. My question is, will it eventually, with more people getting vaccinated? Is there a threshold where you won't need to contact trace anymore?
I would tell you that if and when the COVID-19 is completely eradicated, which it won't be, that may be the case. But as long as COVID-19 is here, and until we get everyone immunized and reach what we would consider to be 80 or 90% of our population with herd immunity, case investigation will still be important. There will still be pockets, whether the pockets are in Pennsylvania or whether they're nationwide, that will be difficult to reach. Difficult to reach not only with testing and contact tracing, but difficult to reach with the vaccine. So our plans will continue until we have the confidence that we have everything under control.
Thank you. Next up, we have Bill Kibler from the Altoona Mirror. Go ahead, Bill.
Thank you. My attention drifted a little bit, so I apologize if I didn't hear this properly, but you spoke, Michael, a little bit about surveillance testing. Is that beginning now? And how extensive will it be if it is beginning now? Because I always understood from Dr. Levine that it was something that was kind of desirable, but well in the future.
Well, that's a good point, and Dr. Levine is on the mark. The future is going to be here before we know it. If you consider that right now we're doubling down with our testing, making certain that we identify any disease across Pennsylvania so that we can mitigate that disease. Once the disease starts to level off and vaccine becomes more prevalent, we'll still need to do testing. We'll still need to do that surveillance testing to determine where there may be pockets of disease, where there may be special attention for mitigation efforts or to really direct more vaccine. If you consider the department and DHS have been doing a type of surveillance testing from the very beginning in our long-term care facilities. You'll hear much about universities that are returning this spring who are entering into surveillance testing, where they'll get a baseline and they will test frequently over a period of time. Again, and that's to identify any of those pockets of disease that will need special attention. So I would say to you that surveillance testing happens basically in partnership with regular testing, but there hasn't been a primary focus on that. It is my goal to really take a look at surveillance testing probably within the next 90 days, and you'll hear more about that later.
And then I have another question on a sort of a different subject, and I guess this is for Lindsey. Could you talk a little bit more about the need for support people for those who need to quarantine and I suppose those who need to isolate?
Sure. Previously, when our public health nurses were doing case investigations and contact tracing, we learned pretty quickly that, again, we had a capacity issue. When we talk with folks and we ask them to quarantine for 10 or 14 days, we're often hearing from folks that they might struggle in doing so, either because of worrying about losing their job, worrying about food insecurity, housing issues, et cetera. The social support coordinators that we have on board have referrals made to them by our contact tracing or case investigator team. And those individuals then work with folks who are quarantining to make referrals, and then also check in with those folks along the way to make sure that they have what they need. We've also been working in collaboration with our sister agencies at the Department of Human Services and the Department of Drug and Alcohol Programs, as well as the Department of Aging, because again, we all have to work together in this fight.
Thank you.
Thank you, Bill. Next up, we have Alan Yu from WHYY. Go ahead, Alan.
Hi, can you hear me?
Yes.
Yes.
Hi. I'd like to ask, this might be for Director Huff, a follow-up question to the testing for the variant of the virus. Two questions. I guess first of all is, do you do we know how many samples are being sent from Pennsylvania to the CDC to be tested? And are those representative? Like, I'm assuming you can't, send a large number of samples to be tested. And so talk a bit about how those samples are chosen, if they're representative of kind of the spread across the state.
Alan, that's something that I will have to follow up with you on. The exact number I do not know, or the regularity of the submission of the samples, but we'll get you all that detail certainly after this press conference.
Okay, thank you. I have one other question, and that is also about the testing for the variant. And are there any other existing facilities in the state of Pennsylvania that could do the genetic sequencing required to test for the variant? And if so, would those be sort of places that the state could work with?
I am not aware of any, but I wouldn't say that there are not. I would suspect that there probably are, and that would. The important thing is in terms of having the right personnel with the right training to do that particular type of testing, but we'll fold that into a response to you as well in terms of the number of tests that go to CDC.
Got it. Thank you.
You're welcome.
Thank you. Next up, we have Sherry Melnick from PLS Reporter. Go ahead, Sherry.
Hi, I don't have any questions today. Thank you.
Sure. Next up, we have Paul Go from the Pittsburgh Business Times. Paul, let me just get you to unmute. There you go. Go ahead, Paul.
Hi, thank you, and thank you to Lindsey and Michael to do this. I wanted to check with you about two things. One, Lindsey, you were talking about the funding mechanism for the contact tracing and the case investigation, and that you've been able to kind of move some funds around to fund that. How long is that before you sort of run out of money or need more money to do so? Because I would expect that's not an inexpensive thing to do.
Yeah, no, thank you. It is not. So we're working right now with our vendor to kind of kick out the can a little longer, and again, further the longevity of the program to be able to meet our needs. At this point, we are looking to the end of February, but are continuing to work with our vendor again to make sure that we can elongate that if we're able to do that.
Thank you. And then also, there's a little bit of a plateau that Dr. Levine has talked about and that the numbers have happened, but we're not yet in that 2-week zone with Christmas and New Year's and gatherings. And I'm wondering if you are thinking of gearing up for that potential bump that might be happening in the next couple of weeks?
Yes, that's a great point. I think the last 2 weeks have allowed for us to take a bit of a break, even though we still are making calls and we continue to do so. But I do think that you're right. We might see some increases after the holidays. And again, are increasing staff to all of the special teams we have, the Connect and Protect form, the 1-877-PA Health line, and then our traditional contact tracers and case investigators, just making sure folks are ready and our systems are ready to be able to take on that capacity.
Thank you.
Thank you. Next up, we have Erin McCarthy from the Philadelphia Inquirer. Go ahead, Erin.
Hi, both of you. Thank you for taking the time today. My question is about contact tracing and testing efforts and that balance with vaccine rollout. Have there been any conversations about reallocating resources at any point from contact tracing and testing efforts to vaccine rollout, given that has gotten off to a slower start than expected? And I know there's some clamor for staff to help with that effort.
Thank you for that question. It's a very important question. And I can tell you that the Department of Health has an extremely robust plan in terms of being able to roll out the vaccine as they receive the vaccine. There have not been specific questions of moving resources around to initiate additional vaccines, only because we're still doubling down on making certain that we get the testing done and the contact tracing done so that we can continue to control the disease until widespread vaccination is available in Pennsylvania. I think all things are on the table. I don't want to speak for Dr. Levine, but I know that Dr. Levine and her team have done a good job of problem solving any of these scenarios, and I would leave that to her to respond to.
And to follow up on that, and I don't know if this would fall under your area of expertise as well, but do you know if the COVID PA app would perhaps be used as part of vaccine rollout, or what do you see that app as serving as in the future as things change, like you mentioned?
At the present time, I would not see that involved in the vaccine effort. I know that Lindsey's team continuously reviews the app and does appropriate updates. And it could be something that in the future we may add something that would facilitate the acknowledgement that somebody had a vaccine or not. But right now, that is not being used.
Thank you. Next up, we have Hayden Ali from CBS 21.
No question this time, thank you.
Thank you. Next up, we have Hayden Mittman from WLVT and PBS 39. Go ahead, Hayden.
Hi, thank you. It's nice to see I'm not the only Hayden reporter in Philadelphia in the state. I was hoping you could expand a little bit on surveillance testing and the need for it in Pennsylvania. And also, is that these strike teams that are out around the state, is that helping with the surveillance testing? And how could this surveillance testing improve our numbers or help us address the virus throughout the state?
Well, let me answer your second question first. The teams that are out around Pennsylvania in the 5 counties absolutely do help with surveillance testing because if you'll recall, patients may come get tested and not show signs or symptoms of disease. So obviously, if someone is symptom-free and they are positive, then that would be an asymptomatic patient that we may not have known had they not been tested. The surveillance testing primarily is for the patients that have no symptoms. We wouldn't necessarily know that they need tested. And that's why we made certain when we initiated our contract with AMI that people with or without symptoms could be tested. And we're also encouraging our other partners. As you know, we have significant sites across Pennsylvania, but we're encouraging other partners to actually test those individuals that may not have symptoms as well. The surveillance testing I'm talking about specifically that I would like to see in the future is I would base it on what our epidemiology professionals identify as areas where there has been disease or is no disease, and I would want to send testers there to make certain that they wouldn't be representative of that 25 to 40% of patients who have no symptoms. So that's primarily what the surveillance does. It helps me identify people that may have disease, that do not have symptoms, so that I can then isolate, quarantine, and mitigate that disease, and they won't spread it to others.
Great, thank you. We have time for one last question today, and that would be from Taylor Tasha from ABC 27. Go ahead, Taylor.
Hi, thanks for doing this today. In yesterday's press conference, Dr. Levine had mentioned a decrease in participation when it comes to contact tracing. So with seeing possibly an increase of cases following the holidays, how important is it for people to really get on board with this, answer the call, if they miss the call back? So how important is it as we come out of this holiday season?
It is so important because, again, I think there was a question earlier about what we're seeing and when we're talking to folks, and I can say that, regardless of where folks are, close gatherings are really where we see the virus spread. So it's very important for folks to answer the call, respond to the Connect and Protect form, and provide as much information as possible so that we can help protect you and your family.
Thank you so much. That is all the time we have today. Thank you both to Director Huff and to Lindsey Mauldin for your time today. Thank you, reporters, for yours. Everyone have a great rest of your day and stay safe.